showing his appreciation for NHS staff last night, we now know the Prime Minister was already having symptoms of coronavirus. And this morning it was confirmed.
Hi folks, I want to bring you up to speed with something that's happening today, which is that I've developed mild symptoms of the coronavirus, that's to say a temperature and a persistent cough. And on the advice of the Chief Medical Officer, I've taken a test that has come out positive. So I am working from home, I'm self-isolating, and that's entirely the right thing to do. But be in no doubt that I can continue, thanks to the wizardry of modern technology, to communicate with all my top team to lead the national fight back against coronavirus.
Well, Mr. Speaker,
and he wasn't the only one. The Health Secretary, Matt Hancock, seen here just 2 days ago at Prime Minister's Questions, has also tested positive.
I've been working from home over the last couple of days because everybody who can work from home should work from home. I've also had some mild symptoms of coronavirus and upon medical advice I was tested and that test has been positive, so I'll be self-isolating here until next Thursday.
Also with symptoms, the Chief Medical Officer, Chris Whitty. He hasn't been tested but is self-isolating. But if the message from Downing Street was to keep calm and carry on, one senior figure, Dominic Cummings, didn't help. The Prime Minister's spokesman later refused to say what exactly had prompted the hasty exit. The Prime Minister, though absent from today's press conference, was the subject of it. Specifically, why he and the Health Secretary have been tested for the virus when many, including key NHS workers, still haven't.
Firstly, that you must have clinical symptoms. The default position without that is you would not be tested. And then the only other criteria would be the centrality of your role to the COVID-19 response. In this particular case, I'm sure your viewers will understand that the Prime Minister plays a very critical role in that, and that's the basis for our testing.
And after days of questions over the availability of testing for those on the front line, finally some movement.
We will be rolling out staff testing across the NHS beginning next week, starting with the critical care nurses, other staff in intensive care, emergency departments, ambulance services, GPs, and as the testing volumes continue to increase, we want to expand that to a wider range of essential public service workers, including our social care services, as well as, of course, continuing with the patient testing, which is so vital.
One Cabinet Minister, still not self-isolating, used the moment to appeal yet again for caution.
I think that many people will reflect on the fact that the Prime Minister succumbing to the virus is a reminder of how seriously we all need to take the advice that the NHS has been giving us.
As if we needed any more proof that the coronavirus doesn't discriminate, the latest victim, the Prime Minister, is self-isolating here in Downing Street. Not at number 10, but behind me in number 11, where he lives. The Chancellor, who would usually be working here, has lent him his office. The door between the two properties has been sealed, and food will be left on the doorstep for him so that he can work here for the next 7 days. But although this one high-profile case will undoubtedly dominate headlines, the business of steering the country through this crisis has continued. The government has strengthened protections for renters, instructing courts to suspend any evictions for 90 days. The housing market has also effectively been frozen, with buyers and renters urged to delay moving. And to protect the homeless, local authorities have been told to house everyone sleeping rough in hostels and shelters by this weekend. Coronavirus has taken hold in Westminster, and across the country concern is growing as well. And so are the numbers, with confirmed cases now at 14,579 and the death toll at 759, up by 181 in one day. All of this puts pressure on the government to show that the action they have taken is working. And as the person ultimately responsible, it could be a lonely few days for Boris Johnson.
Well, we're joined now by Jonathan Powell, who was Downing Street Chief of Staff under Tony Blair. And you can tell us perhaps, how much this is likely to affect the functioning of government with the Prime Minister and the Health Secretary and the Chief Medical Advisor all isolating.
Well, it is a problem. Downing Street is a very small place, so of course lots of people have been affected by this and may well be infected by it. And it's quite hard to self-isolate yourself in a small building like that. But if the Prime Minister is not seriously ill, it is possible to continue with business and he can carry on handling it if he needs to.
I mean, the general scientific predictions, if you like, are that nationally this is going to keep growing, and so one must assume it will also grow within the government and Whitehall. How resilient is the system?
It's pretty resilient because we're not a presidential system. So unlike the US, we don't have to have a vice president who takes over if the president is shot and then a speaker of the House who takes over after that. We have a much more flexible system. So if the Prime Minister can't do it, it usually goes to the next person in line. So in our case, it was John Prescott, who was Deputy Prime Minister. Now it's Dominic Raab as First Secretary of State. After that, they can move it along the normal order of precedence. And they can also, within ministries, move to junior ministers and move people around. It's not like people have to be elected to the post like a president. You get it because you have a majority in the House of Commons.
Well, what about the ministries themselves and the officials? I mean, presumably they are also suffering the same sorts of absenteeism as everybody else.
They will be, but unlike doctors and nurses, it matters a little bit less because they're not frontline staff in terms of going into hospital and potentially giving it to other people. So they can again be replaced. If a permanent secretary gets sick, his deputy can take over. If a head of department gets sick, her deputy can take over. So again, there's quite a lot of resilience in our system because it's a parliamentary system, because we have a permanent civil service with very large numbers of people in it. It's obviously be a strain, but it's perfectly possible to manage.
What have you made of the way decisions have been made over the last couple of months?
Well, I think it's very difficult to criticise a government in these circumstances. They're trying to do their best in very, very difficult circumstances. I think when we look back at it, when the inquiry happens, people may say it was a bit late to move, because usually my experience in government was you have to move quickly if you have a crisis like this with something like foot and mouth. Unless you move quickly, you can't cut it off at the pass. And maybe that's something that will be said after the event, but it's easy to criticise after the event. And now everyone has to concentrate on getting this fixed.
We're in very different times internationally to the banking crisis, for example, or 9/11. If I sort of try to look at sort of big comparable events, you know, do you think there needs to be more international coordination, or does the evidence suggest countries are reacting to their own individual circumstances and that's right?
Well, they are reacting to their own circumstances, but that's not wise. This is a global pandemic. It's not a UK pandemic or a French pandemic or a US pandemic. And it is a shame that we weren't better prepared for it. Everyone knew a pandemic was coming. It would have been better if there had been a better global preparation and there was better international cooperation. In the EU, for example, there was a committee of work done to prepare for pandemics, but then it fell apart when everyone went their each way nationally. And that's one of the things after the event we're going to need to look at. How do we actually cooperate internationally? And think about it for a bit, because if we're in this difficulty as the UK with a developed health system, really good national health service, how's it going to be in Mozambique or in Afghanistan, in countries that are at war, where people are hungry, where their immune systems are down? This is going to be a whole lot more serious in those countries than it is with us.
I mean, how do you think the current situation differs? I mean, what would you have normally expected in terms of world leadership? Would you be looking to the Americans normally?
Well, you would normally want the US to be the main leader on this, but on the global economic crisis, Gordon Brown immediately started working with the Americans on an answer, then expanded it to the G20 and brought everyone in together. So you need a wide group of people. For example, in South Asia, the SARC, the organization brings together India and Pakistan and Afghanistan and all these other countries. They've been working together both at leader level, at the level of presidents and prime ministers, but also at the level of officials and health experts. That's the kind of cooperation that you want if you can possibly get it.
I mean, we saw Gordon Brown calling for that to happen again. I mean, it doesn't particularly seem to be happening. In light of that, is there anything else that should be done, or is the government doing pretty much all it can do?
I think, again, it's very difficult to criticise a government in the middle of a crisis. The thing to do is to try and support them. But I think when we look back at it, when there is an inquiry and when we come to look at it, I think the main thing, as I say, will be moving fast. If you can cut these things off early, I remember back in foot and mouth, if we had moved a week earlier, we might have been able to have the elections when we'd hoped to have the elections. Instead, we had to put them off because we hadn't moved fast enough. So I think that issue of speed and being taken seriously, and most of all, having very clear messages, having messages that people can clearly understand and clearly cooperate with. If you have mixed messages, it gets very, very messy indeed. I think that's why Rishi Schumacher's done very well indeed, because he's actually been out there with a very clear message and with some empathy and reassurance, because what you don't want to do is give people fear. The leadership has to demonstrate that they've got this under control, that they have a plan, that it can be solved.
Jonathan Powell, thank you very much. Well, Downing Street has insisted the government is doing everything it can to secure new ventilators for the NHS in the coming weeks, although there are no details on whether manufacturers have yet been able to switch production. Guidelines for health workers across England are also due to change, instructing them to wear protective equipment. That's if enough supplies are made available. Paul McNamara reports.
Full face visors, masks, full gowns and gloves. The essentials of an intensive care unit looking after coronavirus patients. But for all others in the healthcare system, two things remain unclear. Just what personal protective equipment they should be wearing and when a new supply is arriving. One junior doctor, tired of asking those questions himself, took to Twitter. Dr. Samir Afzal wrote, "This is what we call PPE. I might as well go outside and lick a bus window. Sort it out, Matt Hancock." One accident emergency doctor we spoke to said that he and his colleagues were, quote, rolling the dice every time they were in the same room as someone who potentially had coronavirus. And up and down the country, doctors and healthcare staff are saying that a shortage of kit and a lack of clarity over what should be worn, when and where, could potentially cost them their lives. And that fear has seeped through every level of the stretch system.
At the moment, the equipment is a standard mask, an apron and gloves. We think that the mask and the gloves are fine. The apron at the moment doesn't cover arms and doesn't cover neck, so that is an infection risk potentially. And we don't have, most practices don't have eye equipment.
No word, though, about PPE in today's daily press conference. Instead, an update on the number of beds freed up for this fight, the equivalent of 50 hospitals worth.
Today, across England, we have reconfigured hospital services so that 33,000 hospital beds are available to treat further coronavirus patients. It's also why we are taking the extraordinary action to build new hospitals in very short order, starting with the NHS Nightingale Hospital in East London. And today, because this is a problem, of course, not just confined to London, but across the whole country, I have given the go-ahead to the building of 2 further of these NHS Nightingale hospitals, beginning at the Birmingham National Exhibition Centre and the Manchester Central Convention Centre, with further such hospitals to follow.
Nightingale Hospital sounds more charming than the reality government is preparing for. And this is that reality. A picture from inside London's Excel Centre. Coronavirus patient care stretching a kilometre long. So the number of beds may have increased, but ventilators for the worst affected patients are still in dangerously short supply. One way to boost numbers would have been to join a pan-EU effort to bulk buy them. Only the government has said that due to a communications mix-up, they did not receive emails and missed the deadline. Today, the EU said it was discussed several times in the meetings of the Health Security Committee, where the UK participated.
Member states in the UK had the opportunity to signal their interest to participate in any joint procurements.
Today, the government said the 8,000 ventilators we currently have will soon be matched by another 8,000. But the time frame is still uncertain, and time frames are something disease has no respect for.
Well, earlier, before news of the Prime Minister's diagnosis broke, I spoke to the Business Secretary Alok Sharma, and I asked him if it is safe for people to assume that if the coronavirus crisis goes on for longer than 3 months, then so will the financial support.
Yes, I think it is safe to say that we will continue to provide support for people through this unprecedented time. The Chancellor set out an unprecedented set of measures to support businesses, to support employees, and indeed the self-employed as well, as you saw yesterday, and has been very clear. We will do whatever it takes to support our businesses, to support our people, and ultimately this is about keeping them safe as well.
So we're now in a position where self-employed tradespeople who are currently feeling they have to go to work could effectively stop or massively cut down and reduce the spread of the infection. Is that what they should be doing?
Well, right from the start, Christian, we have followed the medical advice that we've been getting and the scientific advice that we've been getting, and that is an approach that the government will continue to have. We have said that we want people to work from home where that is absolutely possible, and there are very many people across our country who are responding to that. But there will be circumstances where people cannot work from home. They either have to go into a workplace or, as you say, they are self-employed. And of course, then what we say to people is observe the Public Health England guidelines.
So the painter and decorator, who at the moment was feeling, look, I have to go to work tomorrow to make some money to put food on the table, he can now claim this support. Now, if he stays at home, he is making Britain a safer place. That's what I'm trying to work out. Should he now stay at home?
Well, yeah, as I said, ultimately this does come down to where people's workplace is. We've made that.
Painter and decorator has to go to other people's homes.
Sure, and we have also set out the guidance in terms of how they ought to conduct themselves if that's what they choose to do. But at the end of the day, you're absolutely right. This is about keeping people safe and making sure that we protect people's livelihoods, and that's
so
what
should he do? Should he stay at home?
Well,
now that he can, because he can claim the money.
As I said, the advice is very clear. We want people to. Well, Christian,
I mean, you need to say he should stay at home or he should go to work. Which is it?
Well, what I'm saying is that we've provided the support, and as you yourself acknowledge, it is unprecedented in terms of the level of that support. But where people choose to work, of course, they need to do that in a way that keeps them safe and those that they work around safe as well.
What have you learned about, the human mistakes that take place when you're trying to deal with a crisis like this?
Well, look, you learn through every single situation like this. I mean, I was housing minister appointed within a couple of days when we had the tragedy at Grenfell. We have learned lessons from that. We will continue to learn lessons. But when you talk about PPE, I would say to you that in the last 3 days, we have made sure there are an extra 25 million more face masks, which have gone to the front line. 15 million more face masks, 25 million more sets of gloves, 1.9 million eye protections, and every surgery.
Sounds good, but as you know, that lasts a few days.
Sure, but what we've ensured is that absolutely every doctor's surgery, every pharmacy, every dentist has had supplies into them, and we will continue to make sure that those supplies are made available, because we want to keep our NHS safe. We want to keep the brilliant people who are working in the NHS safe so that they can keep us safe.
When it comes to the European buying mechanism for respirators, I mean, was that just a cock-up?
Well, I think, as I understand it, there was a miscommunication. The tendering process had already started. What we've said is that if there are future such schemes, we will look at them. But of course, as the EU itself has said, that every single country is looking to see what it can do by itself. That is what we are doing. We've got 8,000 ventilators on the front line, another 8,000 coming through our normal supply channels.
Do you know how it happened? Because I mean, it was publicly announced. I mean, it's not like we didn't know. Nobody knew this was happening. I mean, well, it's quite alarming that happened, isn't it?
As I said, I mean, I think there was a miscommunication on that occasion, and that's what the situation was rather than anything else. And if there are further such schemes, we will look at them. But we also, in the UK, have launched the ventilator challenge, and it's amazing. We've had over 3,000 British companies that have come forward which have responded to this. We're working with those companies, looking at designs, and ultimately, of course, those designs need to pass a regulatory test, so they need to be safe. I hope within a matter of weeks we will get some prototypes up before we move to a bigger supply coming through.
As the money man for the government, you are going to have to work out how this is repaid, all this money. I mean, do you have any idea? I mean, are we effectively going to print money to pay for it, or are we going to have to pay for it in our taxes?
Well, your viewers watching this, their first concern will be to make sure that their livelihoods are secured, that their businesses are secured, and that's what we have done with the unprecedented packages that we put out, which by any international comparison are incredibly favourable. Of course, there will be an impact on short-term borrowing, but the fact that we are protecting jobs and businesses now means that when we come out of the other side, those businesses will be able to operate normally and therefore provide a boost to our economy.
But is your principle to try and minimise the pain on the other end of this, when the bills come in, or are we looking at, years of repaying this? The way we did after the banking crisis.
Yeah, I mean, our principle right now is to make sure we provide support for business and individuals, and that's what we're doing. After the announcement yesterday evening that the Chancellor made, I spoke to both the TUC as well as the Federation of Small Businesses. Both have welcomed the measures that the Chancellor has been setting out. There will be an impact on short-term borrowing. we will have to deal with that, the other side of this particular situation, but we want to make sure that our businesses are able to be resilient and able to deliver when we get to the other side.